That in a life or death situation, the government would do all it could to help save your life. It's an assumption one Wellington County man had until the province refused to pay for a drug that doctors say could keep him alive. CTV's Andrea Hartling has this for us tonight. Andrea.
Rosie, 26-year-old Lucas Maciesza has a rare blood disorder that is slowly killing him. His doctors want to administer a drug to him that has been approved by Health Canada, but the government of Ontario won't pay for it.
Lucas Maciesza has been dealt a difficult and demanding diagnosis.
The current situation that I'm in is unpleasant, and I'm tired of being sick.
Maciesza has Paroxysmal Nocturnal Haemoglobinuria, a rare blood disease that will kill him if he doesn't receive treatment. His doctors have prescribed the drug Soliris, a possible cure for the disease, but he hasn't been able to get it. The drug costs $500,000 each year, and the government of Ontario won't cover the cost.
We didn't think our government would actually make a decision whether our son will live or die. That's not really their role, I don't think.
Without the drug, the family says they are left with risky alternatives.
The alternatives are things like bone marrow transplant, which comes at a very, very high cost, and the probability of success is only 62%, with tons of complications after.
They are hoping the public will contact government officials and urge them to fund the safer treatment.
A spokesperson for the Ministry of Health tells us that there are concerns about the clinical safety, clinical benefits, and cost-effectiveness of the drug. The ministry is now working with the manufacturer to collect more data.
But Soliris has already been deemed safe by Health Canada.
It's available, but it's not, and it's confusing as to why something like that it is that way. For not only me, but for others as well. I don't get it.
This local MPP heard about the situation and took action.
I contacted the Minister of Health yesterday afternoon and called upon the Minister to intervene to assist this family and to ensure that the drug Soliris is provided for Lucas to save his life.
Health Minister Deb Matthews tells CTV, "I am aware of this family's situation and my heart goes out to them. I have asked the Ministry to ensure we are considering the family's request as quickly as possible. Ontario relies on the advice of medical experts when making decisions on the drugs the province funds. This family is just hoping the drug is approved before it's too late."
Lucas is currently in hospital receiving treatment for the internal bleeding, blood clots, and severe kidney damage that has resulted from his illness. The family hopes